I will let you know, and hopefully either you or Malika can share it in my place. Can you see my screen?
Yes.
Okay, wonderful. So is it good to start?
Yeah, please.
Okay, wonderful. Okay, so with today's presentation, I would like to take you through a brief introduction on the social protection. The acronym is SP that you might find during the presentation. The social protection delivery chain, an overview of the core MIS tool, and the functionalities that are being migrated to the openIMIS platform. So social protection consists of policies and programs that are designed to reduce poverty and vulnerability by preventing, managing, and overcoming situations that adversely affect people's well-being. We have here a diagram that on the horizontal axis breaks down the different age groups. So we have the children between 0 and 5, the youth between 6 and 18. Then we have the adult people between 19 and 65. And then we have the more senior people, 66 years old and beyond. And on the vertical axis, we have a measurement, which is what we define human capital accumulation. And the two lines that we display are two possible paths. The one in blue is the one of a child which is born in poverty, and the one in green is the one of a child which is born out of poverty. So what we can see that already at the beginning of life, a child born in poverty might have less chance of accumulating human capital and making a better and healthier and longer life. So already there can be initiatives and programs of social protection that can help from the beginning to close the gap in inequality of opportunities. As the um, as the two, let's say, standardized child of this graph progress, we see that the child which was born out of poverty basically continues accumulating human capital across the life cycle, while a child born in poverty, under right circumstances, might be able to get closer to an ideal situation, but can also be afflicted by shocks. So we see the dotted blue line that shows that the path might actually not be one of accumulation, but might be a situation in which the person start being affected by different shocks. So in order to minimize the shocks and to support the person throughout life, then social protection comes in. So there are three key goals for an effective social protection system that can be provided for the life cycle. So we see here again, on the horizontal axis, the four different groups. So the two initial groups, as we see, are the ones of accumulation of human capital. The adult life is the use and protection of human capital. And then the last column, let's say, in the old age, is the one of protection of human capital. So the three different goals are the goals of equity, which is highlighted in orange, which is to reducing poverty, inequality, promoting equality of opportunity, and addressing exclusion. Then we have resilience, which includes providing insurance against and building the capacity to manage shocks, and opportunity, promoting investment in human capital and helping men and women access productive work. So for each of these different age groups, there are programs that can be targeted in supporting people. For example, that can be child allowances or fee waivers. That can be emergency cash and in-kind transfers. For example, if there's a typhoon or if there's, let's say, the COVID-19 outbreaks and people cannot go out from home, then can be special transfer that are provided directly to the households or the individuals to support them going through different times. There are also CCTs. CCT is an acronym that stands for conditional cash transfer, which is basically cash transfer, so transfer of money that are conditional to meet certain requirements. For example, attending preschools or going to healthcare visits or attending care services or doing public works when people are already adult or attending training and internships. So there's a wide range of programs that can be provided. I hear someone in the background. I don't know if we can mute the mic, or is there a question? Let me see. Okay. So if we think of it,
I think that maybe now Andrea had been muted by accident. Andrea, we lost you for a second.
okay, I think someone muted me.
You're back now. Yeah. Okay.
Okay, I'm back, I guess. Can you hear me?
Yes, we can hear you.
Okay, wonderful. So as we were saying, there are different programs that can be designed and implemented by government or institution to support vulnerable people. So each of these programs will have some phases and some steps that have been outlined here in this delivery chain flow diagram. There are 4 main steps. There's an assessment step, there's an enrollment step, there's the service or goods provision, and there's the management step. If we look at it a bit more in detail, we see that each of these steps can be broken down in different smaller steps or activities. The first one is the outreach. Is basically informing people about a program. The idea is that people might live in remote areas, might not be aware that there's a program that, let's say, a government is launching to support, let's say, women from poor households in a country. So the first step is outreach. There's a second step, which is intake and registration. Is basically to get a list of potential applicants that might be interested in the program. Different programs have different dynamics, so it's possible that is demand driven. So people are told during the outreach that they should contact a certain phone number, or they should apply online, or that they need to wait for a visit at home. In some cases, that's also an approach. So there are teams that go out and visit the different houses. Maybe they are social workers, or they are people from the Statistical Institute that will find potential eligible people and get their names on a list. The first step is a very important one, which is the assessment of needs and conditions. Usually these programs have a limited budget, so not everyone who is interested in the program would be able to get it. And this is quite straightforward, especially when it comes to unconditional cash transfer, meaning that there's a transfer of money without even having to perform work or attend schools, etc. So potentially everyone, even if they don't fit the right criteria, might want to join the program. And that's where the assessment is very important. The assessment can be performed in different ways. Sometimes it's categorical, meaning that you check if a certain condition is met. For example, is a woman pregnant, or is someone above or below a certain age. In other cases, you want to link the program, the eligibility to a program, to an economic situation. In some countries, there's the possibility of accessing data, for example, from the tax administration records or the ownership of vehicles and so on. But in other countries, this information are not available. So that's where data collection is very useful. So teams will go to the field, will collect information about the household composition, the number of household member, children, their education, and perhaps also about the dwelling condition. For example, do they live in a thatched house? Do they live in a brick house? And the type of commodities and goods that they have. Do they own a fridge, a radio? Do they own a sofa? And so on. Once all the data have been collected, there is the eligibility that's established according to the program rules. So as we said, it can be categorical, or it can be a formula that combines all these different indicators and come up with an estimate of the economic and vulnerability situation of a household or individual. And based on a certain threshold, people will then be enrolled or excluded from the program. At this stage, and we will mention it later, all these steps can also be performed by what we call a social registry. A social registry is an information system that collects data about applicants of a program, or in general, citizen of a country. And then based on the available data inside, it can recommend individuals to different programs. It's also useful to collect information about attendance and participation of people and individuals to programs. For example, you might not want to give 2 or 3 programs to the same person. So in order to be able to distinguish if someone has already received the program, you need to have a centralized database that has a view of all the programs and assistance that individuals and households have received. We were at point 5. At point 6, basically, the people who have been selected and also the applicants who were not are usually notified and they are onboarded. The step number 7 is the actual provision of benefits and or services. So here, as we mentioned, there are different types of benefits. There can be cash transfers, which can happen over the counter, so physical cash, or can be electronic money transferred to any wallet or a bank account. There can be public works. This is a type of conditional cash transfer, meaning that people need to work, and then based on their participation, let's say the number of days they work, then a salary will be calculated. Then there can be training programs. There can be goods that are being delivered, for example, a food basket or blankets or bicycle. There can be saving schemes that are facilitated, and there can also be some sort of insurance mechanism to allow people to save and then get support when in need. The type of benefits are not mutually exclusive, so some programs might do a combination of these benefits. As we see here, between 7 and 8, we have a sort of recurring cycle, meaning that this program might not be a one-off. So cash transfer, for example, can be on quarterly basis, and they can go over for different years. On step 8, we have what we call the monitoring and GRM. GRM stands for Grievance Redress Mechanism. So this is a way to check compliance of beneficiaries with the program rules. Beneficiary, of course, can also be suspended if needed. There can be updates. We know that the household information and composition can change across time. And also there's recording of grievances. So for example, someone felt that she was excluded or wrongfully excluded by a program, or not selected, or there were other issues. And so these grievances can be reported and then can inform also the reassessment of people. So we see there a loop that goes from A to 3. The idea is that this program are not meant to go on forever, but there should be a reassessment of the participant in order to check if they are still eligible, and if not, to graduate them from the program and, let's say, make space for other people who might be eligible. And the last step is basically the exit decision, which is uh, to graduate people from a program, or basically exit them once a certain period or certain conditions have materialized. So this is basically the context of social protection. And as we said, in order to make the delivery chain work, it's very important to have some systems, some digital platforms that can help implement in a robust and affordable way these social protection interventions, especially during emergencies. Unfortunately, some countries experience delays and inefficiencies when they try to independently create a system. This can lead to redundancy and hamper progress of the program. There can be capacity challenges. So the contracting and developing on tools might pose complications, perhaps because of um, requirements which are not well specified, or situation like vendor locking, where a developer start setting up the platform, but then does not do the appropriate capacity building and transfer of code and knowledge to the agency that contracted them, and the agency basically uh, is is forced either to renew the contract in order to have upgrades or continue support to the system, or to start from scratch. And often this decision is tricky, and that's what we define as vendor locking. Open source solution, as we all know, because we're part of this community, a way to improve on this situation and basically offer an already strong product that can be customized and can be easily configured by the adopting agency. Of course, it requires capacity as well, but at least the source code is available. So I am part of the openIMIS team, the coordinator from the World Bank side. We also have the principal developer who's connected, Malika Kande-Lewis. And we have been working since 2020 with the World Bank to develop this tool. Initially, under the pilot, it was a Java-based platform that was meant to support rapid emergency cash transfer during the COVID-19 pandemic. We did quite a lot of work aligning with the delivery chain flow, and we created more than 18 modules that basically cover the different use cases and enhance its versatility. The tool was adopted, was piloted in different countries and officially adopted in Zambia, where it supports the country largest social cash transfer there, which is called Jewel, and is also used for other programs there. In March 2023, the World Bank, BMZ, the Swiss Development Corporation announced a new open source software, which basically merges the openIMIS features into the Python-based openIMIS toolkit. So this is a modular open source solution, as you know, and the beauty of it is that comprises both the health part, health insurance, which is in a way the strength of openIMIS, with the cash and other type of economic inclusion program, which have been the strength of the core MIS platform. This allows to have a comprehensive digital public good that integrate the best of both worlds. And there is also a focus on the interoperability standard as part of the Digital Convergence Initiative, to which both GIZ and the World Bank are part of. When we talk about social protection functionalities, here we have on the right side the 4 steps of the delivery chain flow. You will see assess, enroll, provide, and manage. And below, there's a list of modules, or let's call them functionalities, that have been developed under the core MIS pilot and that are being migrated to the openIMIS platform. Because the modules are several, then we had to prioritize. And what we thought was the most urgent use case was to have the functionalities to support the unconditional cash transfer. CT stands for cash transfer. So the one highlighted in a box are basically the beneficiary and household registry, which allow to import and manage beneficiary of social protection programs. The upload can be performed with an Excel file. And then payment and reconciliation. Basically, based on the list of beneficiary, it's possible to generate payments and send those payment instructions by API to a payment service provider, who will then deliver the money or the payment to an account, and then provide a confirmation of whether the transaction was successful or not. And this is what we call reconciliation. Then, of course, there's the importance of data updates, because we know that some conditions might change, or someone might no longer be part of the household, and so on. So that's functionality that has already been migrated. And there's also the creation of benefit plans, meaning that unlike the original Java platform, which was designed and let's say conceptualized to be more a one deployment per program, with this new migrated version, there's a possibility of managing multiple programs from the same instance. So you can have, let's say, a cash transfer program to old age people that distributes, let's say, 100 a month, and then you can have another program for another subset of people, let's say pregnant women, that distribute a different value on a different frequency. We also have functionalities of dashboards and reports. This is done by integrating the OpenSearch tool. And this allows analyzing data for interactive and customizable dashboard. Of course, there are user management functionalities. And we also added individuals, which is a way to display beneficiaries from different programs in a single view. Ideally, not just beneficiaries, but also applicants in general. And that's what will help building a social registry. The migration of functionalities is performed by developers contracted by GIZ with guidance from the World Bank team. And additional modules are planned for release in the upcoming months, which include targeting, social registry, GRM, etc. So to recap, the current functionalities which have been included in the 2023.10 release are the beneficiary registry, which allow edit and updating of beneficiary information, household registry, which allows viewing individuals which are part of the same group. So you might have 5 different individuals. One is the household, and then the other one are part of a family. And this is useful, for example, when you want to change the person who receives a benefit inside the household, and you can already see who else is eligible. And then also when it comes to do the assessment, if you know the household composition, then it can help with the scoring. We spoke about individuals, which is the basis of a social registry. Benefit plans, so it's possible to create, edit, and upload beneficiary information belonging to different programs. We spoke about payments. Uh, Payments are basically bills that are generated differently from the insurance model. Here, there's not necessarily a contribution by the beneficiary. It's rather someone is registered, and then the program manager, which can be the government or an agency, then they send money or goods or services to that specific individuals that have been registered. Those bills can be grouped in payrolls, and that's a way of managing payments, because in some cases there can be multiple payments that are grouped. For example, there are delays, so you want to pay every 3 months, but then there was a problem, so you send money for 2 quarters in a go. We spoke about Task Manager. This is something new that has been added, and I think is beneficial also for openIMIS, is what we call a maker and checker logic. So instead of having action applied to the system as soon as one user presses a button, we have the possibility of configuring a multi-stage approval. So let's say that you want to generate payment. Instead of having someone click and generate bills directly, you might have the process of clicking the button, and then someone else with ideally a higher responsibility of rank might review and decide to approve or deny the request. So actions are not performed until confirmed by authorized users. Of course, customizable profile creation. And then when it comes to dashboards, we spoke about the open search, and this creates a sort of data lake, and then data can be displayed, charts created and customized as needed. There's a very intuitive interface, and it's possible for administrators to create dashboards, and then users can log in and drill down the charts at the same time and create their own analysis and export data as needed. In terms of future releases, there are, as you saw, different modules that are yet to be migrated. These include targeting, so to have a customizable workflow for different implementations. As we said, it can be categorical, or can be what we call a proxy mean test assessment, collecting data about different aspects and coming up with a score, and also import data from different sources. So you might want to be able to validate information against different databases or existing platforms, and also do data cleaning. Social registry would imply expanding the individual modules beyond beneficiaries, work on intake and registration of applicants, cross-check information from separate systems, establish the assessment eligibility, and flag duplicates. This is an important feature. Basically, you might have people registering under different ID numbers or slightly different names, but they might be the same person. So having algorithms that allow to spot those cases and merge the records is very useful, so that the government or whomever is managing the platform is able to take stock of those cases, and then take decisions on the eligibility, and in case exit people for one or more program. The grievance redress mechanism is a way to record feedback or grievances from beneficiaries or the public in general, analyze them, and address them, and then inform people about the resolution. During yesterday's session, we had Tuam that spoke about something that they've already set up in the Gambia and possibly also in other instances. And we want to have something similar as we had in the Java version, and make it available to the openIMIS platform. When it comes to payment, we said that we have the functionality of creating payments and do reconciliation by API, but there are also other use cases. For example, that can be the need of printing lists of payments to be performed in the field. So it's important to be able to manage payment generation and reconciliation via Excel files, for example, CSV format, and then also to have integration with different mobile applications that help manage the payments. One such application is what we call the PPM app, Paypoint Manager application that we developed in Zambia. And that helps tracking the delivery of offline payments, including GPS, timestamp, and photo evidence, which can then be synchronized against each individual transaction. Other functionalities include economic inclusion programs such as timesheets, which are useful for tracking attendance of public works, and then calculate the right amount that needs to be delivered to households. Training programs, saving group programs, and other type of programs. And under future releases, we hope also to introduce improvements to the UI and to the configurability of the platform. I will stop here, and I will welcome any question or feedback from the colleagues connected. Thank you.